Welcome to our latest patient education program hosted by Hishir International Specialist Clinics and Research Institute for Misophonia, Tinnitus and Hyperacusis. Unfortunately, our YouTube stream link wasn't working, so I hope that you will find us in our live YouTube program. Each month, we'll be exploring a different topic within sound sensitivity, aiming to give you a broader knowledge and understanding of these conditions. My name is Joanna Barker, and I'm your host for these sessions. I've been an audiologist for the last 12 years, and I'm a specialist in misophonia, tinnitus, and hyperacusis. Today, we are joined by Professor Annick, Head of TINTRA, Tinnitus Treatment and Research Centre, Antwerp, Clinic for Tinnitus, Hyperacusis and Misophonia since 2018, and the Head of the Audiology Department at the University Hospital of Antwerp since 2020. She will be sharing with us her presentation, Can I? The Do's and Don'ts for Tinnitus Patients. In her presentation, she will be exploring questions such as, can I take a plane with my tinnitus? Should I avoid caffeine? Should I protect my hearing more now I have tinnitus? Many questions arise when tinnitus patients experience that their tinnitus is sometimes or often reactive towards certain situations, activities, or foods. In this talk, Annick will explain why and how tinnitus might react in certain ways and how this is perceived, and why obstinately trying to avoid these variations in most probably causes even more variations. Annick has written over 50 papers in various national and international journals, has presented her research at the annual tinnitus congresses, is a board member of the Belgian Ministry of Health and Welfare, has recently appeared on TV, and has also published a book in June 2020, providing answers to many questions patients have concerning the symptoms of tinnitus. There will be the opportunity to ask questions after the presentation, so please feel free to post these through the chat function. Thank you so much for joining us, Annick. I will now hand over to you.
Well, thank you, Joanna, for the nice introduction. Let me first start by sharing my screen so everybody can follow me as well. So, well, again, hello. I don't need another introduction because Joanna already did pretty well. So thank you for having me tonight. And yes, I will try to tell you something a bit more about tinnitus and about some answers to questions that not only you might have, but I have experienced many people have. And I have been doing tinnitus consultation for the last 12 to 14 years, and we often get the same question, and it does never get boring, I have to say, because there are a lot of variations in the questions, and this is because also tinnitus comes with a lot of variations. And in my experience, it are those variations that cause a lot of disturbance, but also anxiety with patients because they actually don't really know what is happening and why the tinnitus is sometimes so reactive to a situation you would say might be very innocent and very often also is very innocent. So that is indeed why I wrote the book, because I experienced many patients not finding the right answers to the many questions they had. And that's why I chose to write this. Now, as this book is written in Dutch, I assume it would be quite hard for you to understand. And I have taken some key messages from the book and some key messages I would like to talk to you about today, and to make some things more clear and provide you with some more insights into tinnitus as a symptom, but also tinnitus as a symptom that affects us in many different ways. And so to start with, I know I don't have to explain, but tinnitus in general, the definition is hearing a sound in the absence of an external sound source. So it means that internally you can hear the sound, but externally there is no really source. So I cannot hear your tinnitus, I cannot make it audible, and every tinnitus is a bit different. One hears more like a pure tone, the other one hears more a noisy sound. Some people hear different kind of sounds. They can also, vary in volume or in kind of sound. You hear one sound the one time, another sound the other time, on the right or the left, or something in between in the head. There are many variations between people, but also in one individual. Now, just to warm your heart a bit more, you are not the only one with tinnitus. Many people have tinnitus, and around 1 in 5 adults experience the symptom of permanent tinnitus or have tinnitus all the time. Do we see all of these patients in our clinics? Luckily not, because we would have even much more longer waiting lists, but approximately 5% of patients in one phase of a certain phase find the tinnitus very disturbant, or it affects negatively the quality of life at a certain point. And that is not because of the actual presence of tinnitus. It's not the presence of tinnitus that really bothers us, but it are the direct or indirect things that tinnitus might cause or can be caused by tinnitus, or vice versa, that have interactions with the tinnitus. And it is when we start experiencing different kind of symptoms, such as concentration problems, sleeping problems, frustrations towards the tinnitus, but also anxiety or depressive symptoms in coexistence with the tinnitus, that the tinnitus actually becomes something that is disturbant and causes a diminishing of the quality of life. And this is something that does not need to remain like this. It's not like when it's now the case that you are really bothered by the tinnitus, it doesn't have to be bothersome for you for the rest of your life. And this is something, a positive message I would like to already pose, and I will try to explain later how we can influence tinnitus, but starting from the point to make you understand how tinnitus might affect you and why it affects you. So in my book, I have many questions answered, and it's all about different aspects about tinnitus, how it's caused, what are the causes of tinnitus. There are many causes, but one is more prevalent than the other. What the effects are for us, for our brain, for our mind, for our body, for our stress level, about the do's and don'ts on tinnitus, and about what currently are the treatments that are available to treat tinnitus. And over the years, people have asked me very lots of questions, and we see a lot of questions coming back. Is it something dangerous? Can you find the source? Can you find the cause? Isn't there some kind of medication I can take that make it go away tomorrow? We are scientists. You should find something, right? Why does it vary in my head? Is it hereditary? How does it actually work? That's not always clear for people as well. Is there some kind of implant possible, or surgery, or what is currently the most effective treatment? So many questions. And beside all those questions, there is very often the question, can I do this or that with my tinnitus, or can't I do it anymore because of my tinnitus? Can I indeed, can I take a plane? Is it harmful to take a plane? Can I still go to concerts or listen to music because I actually enjoy listening to music? Is it still possible? Would it make my tinnitus get worse, or can it do any additional damage? Can I drink caffeine? Very often we hear somebody saying you should definitely avoid caffeine in all circumstances when you have tinnitus, and you should alter your diet or whatever. Can you still do sports? Should you wear earplugs at concerts maybe, but what at night to sleep? So many different questions that people are wondering, can I still do that? And very often we see people stop doing that, or take something out of their lives or stop doing with something they are actually passionate about, which makes also the tinnitus get an extra control over you because you are stopping with something that you actually should be able to enjoy. And I cannot, unfortunately, due to time restrictions, dive into every topic in here, but I will try to elucidate on some topics, and I hope after that you can go further on that path and make your own suggestions on how you would deal with the other questions. And if you cannot manage them, you can always contact me, of course, as well. Now, I think the first question to go there is, how does it work exactly when we are talking about tinnitus? And also in our department, the tinnitus clinic is actually in our ENT clinics, and this is what it happens a lot, that if you go for a consultation for tinnitus, you come with an ENT doctor, and then people always ask, why is it always in ENT? Is it because I hear the sound? Is it because there's something wrong with my hearing? Well, the answer is actually really both, because very often the hearing has something to do with it. Not all the time, but often hearing, there is a hearing impact or something with our hearing. And to understand that, we first need to know how our hearing system works in a normal way when it's not affected by anything. And this is what the next video will show you. You will not hear sound, but you will see the video though. And you see that when sound comes in, it comes in as sound waves, and it's captured by the pinnacle, by our ear, and then it is derived from outside into the outer ear canal, and the sound is going to our eardrum. Now, the eardrum is like a very thin layer, which basically takes this vibration and puts it onto our hearing ossicles. And these are very small ossicles that vibrate in a very specific way to even make this vibration even a bit stronger, and then guide it towards the cochlea. And here in the cochlea, this is where the most important part of our hearing takes place, because the cochlea is actually filled with fluids. And in those fluids, we have thousands hearing hair cells, actually. And it are those hair cells that are um, um, that get this vibration, and due to the vibration, they bring the sound onto our hearing auditory nerve, actually. So at the basis, we have hair cells that are sensitive to very high pitched sounds, and at the top, we have hair cells that are very sensitive to very low sounds. So depending on which sound coming in, whether it's speech or music, these are most often all variations going on. So if we dive into that and we take a look to those hair cells, we see that we have thousands of hair cells, and when the vibration, when the sound comes in, they get swapped away, and like soldiers all together, they perform their task, and they create what we call an electrical sense, an electrical pulse, by which it communicates to our auditory nerve. This auditory nerve that goes to a place in our brain that has the task to process all that we hear and all the sounds that come in. And it is not until then that we are conscious about sound. Everything here is just made to transmit the sound from outside to your brain. And it's only when it comes into our brain that we actually know that there is a sound, that we are getting conscious of it, that we can do something with it, that it can cause emotion or etc., or we can enjoy music. So that is what all happens in our brain. Of course, you see at every level, it's a quite complex system. At every level, something might go wrong, which means that there is less transmission towards the brain. And what could go wrong is, by example, this is an example, is when we have a hearing loss. As I say, in our cochlea, which is the most important region of our hearing, we have those hair cells, and this is how they actually look like. And those hair cells are responsible to transmit these electrical pulses towards our brain. And this is like a very specific region in our brain that is responsible to process these sounds. Now, if these hair cells get damaged by some reason, it can be through noise trauma or noise exposure, but it can also be because of getting older. Also, when we get older, we have this some kind of natural decline in hearing because of the fact that we lose some or part of those hair cells. If those hair cells are not transmitting their sounds anymore to the brain doesn't really know why it is not getting all of the information that it is actually constantly seeking. The brain is used to getting all the information from our hearing, from also our motoric senses, our legs, our arms, etc. But when it does not get that, it gets confused. And our brain is something that is has a lot of flexibility and plasticity. So if it gets confused and it's not really getting what it is supposed to get, it will start looking, or it will create himself. So if the brain is not receiving all of the sounds it should get, then it creates its own sound. And this is how or when you hear a tinnitus sound. For example, when it's looking for hearing sensation and it's not getting it, all of it as it is programmed, it will create its own sound as the tinnitus. And that is the point when we hear the tinnitus. Now, unfortunately, this is not the end, because you might say, okay, let's cut one piece of my brain away, and then I can get rid of the tinnitus, or let's just tell my brain like, okay, I don't need this tinnitus, you can discard it again. Well, unfortunately, it's not that simple, because there is a very specific brain region for processing of auditory signals, but all brain regions, of course, work together. And that is what it kind of makes it a bit harder, and tinnitus a very complex symptom, because if we look at every brain region and what it is responsible for, we do indeed have like a very specific region for auditory processing. It's right above every ear. And if you see the organization in this region, you might recognize a bit of the same organization as we saw in the cochlea. And it's not that it might be the same, it is actually exactly the same. We have a region that gets the signals from lower frequencies coming from the lower frequency region in the cochlea. We have a region for mid frequencies, and we have a region for higher frequencies. And there is definitely a one-on-one messaging from the cochlea to this brain region. Now, if this messaging goes wrong, if we lose some kind of hearing by losing some hair cells, or if we have some kind of ear problem, etc., then the brain or this specific region is not getting the signals anymore, and your brain will notice. Your brain will notice this kind of link is missing. So as a reaction, it will become a bit more reactive and a bit more responsive in this specific brain region. So what happens if these neurons in these brain regions are reacting? That means that this region is active and you will hear the sound. And this is the tinnitus sound. And very often this tinnitus sounds exactly the same like the frequency in the region that you might be missing a bit, or has been lost a bit. And it can be on a temporary cause. It can be temporary when, for example, you go out to a party and afterwards you hear the tinnitus sound, and usually best case scenario, next morning it is gone again. But in some cases it remains permanently. And why can it be remain so permanently so quickly? Well, that is because of the interactions in our brain region, because of course this is the region that is responsible for auditory processing, but we have many other regions that are also involved with tinnitus. Once you hear the tinnitus sound, of course, our attention system, or those regions connected with our attention, will also activate. You are being aware of the tinnitus, your attention goes towards it, but also our limbic system, which is our emotional system, the connection to our emotional system, will also very quickly be active. I always say to people, I've never saw somebody at consultation who was not bothered by the tinnitus, or liked the tinnitus sound. Nobody ever likes the tinnitus sound. No, we dislike it. At first, people are very much afraid of it. It comes in very aggressively. We don't know what it is, why it is staying. So it can lead to panic, frustration, etc. But these are all very strong emotions, and this very strong interaction is something that in a very short period of time can lead to the permanence and the permanently hearing the tinnitus sound. And this is where what we call the vicious circle of tinnitus often starts, and it can start in a very acute way. You get up, you hear the tinnitus, and immediately those attention and perception symptoms regions, they also have their interactions, and of course we have an emotional response that is only human, but this causes this interaction and this network of brain activity which actually makes the tinnitus. So going from maybe a very small activation in this specific auditory region, very soon, or in a very short period of time, the tinnitus becomes a network of brain activation. And that is why it is something that is very complex and also not so easy to target, or not so easy to cut away with surgery, because it's not just one region, it are many regions working together and also keeping their activations going, because this is a vicious circle. Once you hear the tinnitus, and you will pay more attention, it will frustrate you more, it will stress you more, or it causes a lot of disturbance or anxiety. This means that your brain will have the reaction that this is an important signal, something that it has to remain into the attention, and it will again lead towards more emotional responses. And this is something that goes on, and this means that as a reaction, your brain will activate the tinnitus even more, and this is a vicious circle. And this is why it can really affect you at a certain point. And unfortunately, sometimes we see this happen very quickly, which are you are not really conscious about that this is actually happening inside, for many people, or in a certain phase for many people. So knowing this, let's go towards some questions on the tinnitus and how these brain activations affect us. And I think one of the most frequently asked questions is there always a detectable cause, or a cause that we can find? And many people are really in search of the reason why they have tinnitus. And this is probably the most difficult question to answer by caregivers, because there is quite most often not just one reason, but tinnitus is something that is what we call multifactorial. And most of the time, there are several reasons at the same time, or several reasons that make you vulnerable to have tinnitus. And but in that way, cause disturbance. And we already discussed hearing loss. I think that is the most common or the most prevalent cause of tinnitus, whether it is through noise trauma, whether it's through some kind of disease or pathology, but also just getting older. If we get older, our hearing declines. This is a natural process you can do absolutely nothing about. It's a natural way, and so in many people, tinnitus is something inevitable, not something you could foresee or avoid, which is a pity, of course, but also deriving from neck or jaw complaints, and this is what we call somatic tinnitus. So people with an ongoing neck problem or jaw problem, or people who clench their teeth a lot, this might also um, affect tinnitus or affect the volume, how you hear it, or make you more aware of it. More central problems, but also coexistence of people that have more anxiety or more depressive symptoms or are vulnerable to that. In those people, your mental border is much lower, and they are much more vulnerable to having tinnitus, but also much vulnerable to have tinnitus complaints, to be bothered by the tinnitus, because we have seen not everybody who has tinnitus also sees it or feels it as a complaint. And this is something that we do a lot of research about as well, because a lot has to do also with the attention towards the tinnitus, the stress that it causes, and this goes vice versa. Stress can cause tinnitus, but tinnitus also causes a lot of stress, of course, and also the interactions with our functioning. If tinnitus um, um, causes us to have sleeping problems, then of course this is another vicious circle. You get tired during the day, you get less focused, you also mentally everything goes less well if you have some sleep disturbance. So this all in interaction, they co-interact and they interact all with each other, making this tinnitus vulnerability, and also the vulnerability to the disturbance towards the tinnitus. So I think that is something important to take into account. Like, yes, we usually do find several factors that makes you vulnerable to tinnitus. Whether then that exact factor is the actual cause at that moment, it's very often very difficult or impossible to say, but we can see that there are sometimes several factors at play, and it's the factor that is at play the most, or the factors that are at play the most, that we will start and try to target in therapeutic sessions. So it is very logical that if you do not have neck or jaw complaints, that therapeutic-wise physiotherapy will not do anything for you. So there is often no fixed treatment or one size fits all. No, it depends on where your cause is and which factors contribute to your tinnitus, what treatment will be effective for you. Now, why does your tinnitus vary? And I see that this is often source of many complaints or many anxieties of patients, that the tinnitus goes up and down depending if I do this or if I do that, if I do sports, if I drink caffeine, if I drink alcohol, then it does this, it does that. Sometimes it gets better, sometimes it gets worse, and people tend to pay a lot of attention towards there, or try to take any kind of control by doing this but not doing that, because they have experienced that it would change their tinnitus. Now, what I want to make clear is that variation in tinnitus is inevitable, always, in the good way, but also in a bad way. So we now know, and I have explained, that tinnitus is actually a brain activity. And so our brain activity, it varies all the time. If we are awake or if we are asleep, that is something completely different. And our brain activity changes completely when we are very focused on something, when we're doing a presentation, when we are lying on the couch watching telly, if we are studying, if we are doing absolutely nothing, our brain activation changes and alters all the time. This is logical and it depends on what we are doing and what we're not doing and how many tasks we are asking from our brain at a certain time. And so this means that it is very logical that tinnitus, which is also brain activity, goes up and down depending on different kind of things. And then we have a second thing, which is called our perception level. At a certain point, we hear the tinnitus. And this is our perception level. And in the best option, we have a very high perception level, but our tinnitus, which can be there, is lower than this. This is a situation in which the tinnitus is present. We have the tinnitus activation, we have the brain activation in our head, but we are not aware of it because our attention level, our perception level is much higher. You have experienced this before. For example, when you are like very focused on something and very engaged in something, then after a while you might think, I didn't hear my tinnitus or I haven't experienced it at that time. Well, that is because your perception level is higher and or your attention is just filled with something else. The tinnitus is there, but there is no room in your conscious perception for the tinnitus at that time. In the case the tinnitus goes higher and there is an increased tinnitus activity, which is possible in different kind of ways due to hearing loss or acute noise trauma, central problems, neck and jaw complaints that also rises the volume of the tinnitus, then at that point the tinnitus comes above our perception level and we will hear it. What also happens a lot is that the tinnitus might rise or stay on the same level, but that our perception level goes down. And when does the perception level goes down? Well, when we are anxious, when we have depressive symptoms, or we have mental struggles, we are struggling with something, then our emotional border is quite low, and also this perception level is much lower. The same goes if we put a lot of attention towards the tinnitus. If we are really focusing on something, then it is harder to get out of our mind again. When we are very stressed, when we are tired, when we have sleep disturbances, that makes our perception level go down. So in general, we see a lot of patients paying a lot of attention towards the tinnitus. And with this vicious circle, the brain is like really focusing on the tinnitus because we are indirectly learning our brain that this is an important signal and we have to keep this in our attention, which means that this border remains quite low. And this is also why it's not a coincidence that in many people the tinnitus becomes a problem in times of mental struggles or in time of depression, burnout. It are big words, but just periods when we are doing mentally less good. And this is often because then this perception level really lowers to a certain level where there is no situation anymore when the tinnitus is below even that. And so the tinnitus is always on the horizon and is always there to bother you and will keep you from your task that you actually want to do. And you cannot kind of compare this with like a visual task. And I don't know if you guys see something on this drawing, but this is like a black and white dot drawing. And if you haven't noticed this yet, then this is just black and white dots. But if you look closely, then you will see that this is actually a dog with here the head. It's kind of going away from us with here the head, the front paws, the body, and here the back paws. And so now once you have seen it, I can go back a slide, and I'm now telling you, you will see the picture again. Do not see the dog. It's not possible anymore. Whatever you do, you will see the dog. I'm not saying that it is bothering you right now. You might not find it bothersome to see that dog over and over again, but I'm telling you, your level now to seeing that dog is here, and the dog is here below, and the dog itself is over there. So you will see it no matter what I say now. Once you've seen it, you cannot unseen it. And this is what happens when we kind of lower this perception level too much, and it's often lowered by stress, by being disturbed by the tinnitus, by reacting very much towards the tinnitus, that this happens. And this also transfers us a bit to the do's and don'ts on tinnitus. People are afraid to do some stuff, afraid to take a plane. Can I do sports? Is it allowed to do sports? Because I also find it that it makes variation. Can I eat or drink whatever I want? Can I go to concerts? Should I use earplugs, etc.? And as I just explained how tinnitus work and how the brain activity works, and we have seen how, let's say, negative things can cause tinnitus increase, such as hearing loss, neck and jaw complaints, and our perception level to lower, stress, anxiety. I will also show you now what are normal things in life and what we do, as for example, sports, also have this effects on tinnitus. And so if we, like, for example, do sports, what happens? Our brain gets more active. We get adrenaline. We get these very positive and very healthy hormones in our body, also in our brain. So keep in mind that sports is like very healthy as well for physics, as well for the brain. But what happens in this case, our brain activity increases because we are doing sports. We're not lying on the couch, we are doing sports. Adrenaline goes up, we are very active. So logically, brain activity goes up, but also the tinnitus might go along with that. So when people do sports, and maybe at that time your perception level is still quite high, you're doing your sports, you are focused on doing it in the right way. But afterwards, many people tell me, like, after sports, my tinnitus is much higher, has increased much more than before. And that is often indeed the case because your brain is more active. So logically, the tinnitus is also more active, but will lower again once your adrenaline goes down again. And this is something very important that also due to very logical, natural brain activities during the day or during certain activities that we do, our brain activity also increases. So is this something to avoid? No, you should not. You should never avoid these variations, because in this case, you are just doing something very healthy, but it has a temporary effect on your tinnitus. Now, if you know this effect and if you trust the process that afterwards it will go down again, you can do sports again, you can do it and you can enjoy it. The same goes for what we eat or what we drink or what we not eat or what to drink. And I very often hear people say, or some kind of caregivers, like, avoid caffeine at all times. But I always think, like, I also really like coffee in the morning or in the afternoon or in the evening, actually all day. I love coffee, and there's really nothing wrong with caffeine. But what happens with caffeine in our brain? Why do we take caffeine, or why do I take caffeine in the morning? Because I want my brain to activate, be more activate, and I want my perception level to rise. I want the drowsiness of my sleep. I want it to go away. I want to be focused. I want to be attentive. So what happens when we drink caffeine? We lower our perception level. So we are, in this case, we are lowering our perception level for everything, for our environment to concentrate, to focus on something, but also our perception level, of course, for our tinnitus might lower at that specific time point. Again, a very temporary thing. Once the caffeine runs out, your tinnitus will go to normal levels again, your perception level will go to normal levels again. So you might find or you might experience that sometimes when drinking caffeine, you hear your tinnitus more. It is not that you have done something wrong. It's not that you should avoid caffeine. If you like caffeine, then please drink it 1, 2, 3 cups a day. Do not exaggerate it just because everything in a moderate pace is always the best, but you are very much allowed to drink caffeine. So, and after a while, it runs out again and your tinnitus goes to normal proportions again because your brain activity again will change when it has less caffeine. What about alcohol? Different aspects in alcohol. Some people sometimes tell me, Annick, if I drink alcohol, then actually my tinnitus is a bit better. And that is often the case because our perception level or our attention gets driven away from the tinnitus. We get a little more drowsy, we do have more sense of happy emotions, etc. So a little bit of alcohol usually makes people feel better. Once alcohol runs out, and also it's often better to fall asleep, people fall asleep much quicker. But after a while, of course, the alcohol runs out, it works out, and then we have a very temporary shoot in brain activity. That means that we can wake up more easily, and at that time point, our tinnitus might go up as well. Again, very temporarily, and again, this will run out as all substances that we use. The same with caffeine, the same with alcohol. So should you avoid caffeine, should you avoid alcohol, everything in a moderate way you can simply do, and you should not be worried that it might cause any permanent effects because it cannot. So I always think that it is better to do your own thing at your own pace and enjoy yourself, enjoy life with your friends without any sacrifices. And this includes caffeine, for example. Can you go to concerts? I think many people, especially when they have tinnitus due to noise or due to unwanted noise in the environment, they are very reluctant to go to concerts or to listen to music themselves. And even some patients that do wear very nicely their customized earplugs on concerts, afterwards they do panic because they do hear more tinnitus, and then they often get very much freaked out, and the tinnitus tends to become worse. And indeed, we see that when you go to concerts, for example, we see an increase in brain activity, and we often see an increase in tinnitus activity. But then the question is the increase in brain activity or tinnitus activity in this case, is it actually hearing damage? Were you not sufficiently protected by your earplugs? Or is it just increased brain activity? Because of course, if we go to a concert and we dance and we drink something and we have a lot of fun, your brain is of course much more active when you're in the crowds dancing. Your brain is much more active than you were lying on the sofa for the entire evening. So very logically, your brain is more active and your tinnitus is more active, even if you did not have too much noise. So yes, hearing damage can lead to permanent tinnitus activity, but when you go out, you wear your earplugs, and in the evening you lie in bed and it's still a bit louder, that tinnitus, then this is just a normal increase that is very temporary, and it's just because you have an increased brain activity of dancing, of adrenaline. It's like the sports. So this is this case, and you haven't done anything wrong, and you have probably did protect your hearing sufficiently and very well, and also this will go back to the lower level again. So everything in tinnitus you can explain by brain activity and fluctuations in brain activity. And this is why I always say you do not have to avoid anything in your life, and you just need to do the things that you really want to do, and again get confidence in doing those things again. You can perfectly go to concerts if you just wear the good hearing protection, the customized hearing protection, and you can really have fun without damaging your hearing. But will your brain activity high increase, and will your tinnitus be a bit louder after the concert? Yes, it will be, but you should expect that, as it is something logical, but it is not a permanent thing. And this is something we always have to learn in tinnitus treatment, and how to deal and cope with tinnitus, that we need to deal with these variations. And I know they are very hard to understand, but I hope like this pictures you can take in your brain and adapt them to all the situations that maybe you experience as being something bad for your tinnitus. Maybe put it in this vision, and maybe it's just a temporary effect, and a very logical temporary effect at that time. Now, maybe also one of the very hard questions then, okay, now I know this pretty well, but how do I control my brain activity at all times? You don't. It's very simply, you cannot. Unfortunately, you cannot control your brain activity at all times, because our brain is more and less active depending on what we do, and we cannot always be attentive towards it, and we cannot always be in a situation where your brain activity is always very low, just to keep your tinnitus also low, because then you wouldn't be alive, you wouldn't be living your life and doing what you actually want, and also having fun, because having fun also increases just your brain activity, just like that. So what do we want to do in treatment, and what is, for example, counseling treatments all about? It is by focusing on that very low perception level and increasing it. Again, get those perception level again higher, and try to break this vicious circle. Once the tinnitus does not get its feeding anymore from our attention, if we do not pay attention towards it, if it does not deserve our focus, if it's not earning our frustration, our stress, our innervation, then the tinnitus literally loses his feeding, and then the tinnitus sound goes down, because it's not fed anymore by our attention and by our emotional responses. And again, I said, how can you unsee the dog? It's not about unhearing the tinnitus, it's not about unseeing the dog, but it's about fading the dog into the environment. And you might see it once in a while, or you might put more attention towards it. But if the activity of the dog itself has become more fakely, then it is more easy to try to ignore it, and it does not interfere with our image all the time. And the same goes for tinnitus. We have to let it fake into the environmental sounds that are in our environment, and to learn our brain that this is not the most important sounds that we have to take into account, and we will live our lives happily ever after, even if we sometimes hear the sound, or sometimes it comes into our perception. But it's about, what do we do with that perception at that time? That does make a difference of how long this perception will take, or how long it will be disturbance in our lives at that time point. And this is actually what therapies such as tinnitus retraining therapy, but more specifically cognitive behavioral therapy does. It learns us about the interactions with tinnitus, the interactions with our emotional and reactive responses, and how we can change those. Of course, it's always important if we have a hearing problem that we are supportive. I'm also an audiologist, as Joanna, that we are very supportive of every hearing loss. So if you do need hearing aids, they also might introduce also positive effects towards your tinnitus perception as well. Not all the time, but it might help. But most importantly, it supports your hearing or your hearing loss. Besides that, if you have neck or jaw complaints, a physiotherapist might help you. But again, if you have neck or jaw complaints, if you don't have it, then it has nothing to do with it. And even if you have neck and jaw complaints, it does not mean that this is the only factor contributing to your tinnitus. Are there medication possibilities? Yes and no. There is not just one medication that you can take and it makes your tinnitus go away. It's not like you know that it's a brain activation now. It's not like you can put your brain to silence. If you would, then you are dead. Then you're not alive anymore. So we need our brain. We need our brain activity. So sometimes people get medication for anxiety or depression or sleeping, but this affects the depression, the anxiety, or the sleep, but not directly the tinnitus. You are not directly treating the tinnitus. So this is not a tinnitus treatment. This is for the concurrent symptoms that you might experience, but this is often not a long-term solution. Now, there are these days also more, let's say, experimental therapies like neuromodulation protocols, and I would love to tell you about those also maybe another time, because I also have a lot to say about them. But at this time, they are non-proven. They are not yet proven to be effective. So please be careful with those. You are okay to do experimental therapies, but keep in mind that there might be some other more effective and proven solution for you that is possible at this moment. And the same goes for hypnosis or acupuncture. To date, there are no that also are non-proven or non-scientifically proven therapies. So I would stay away from, in a first sense, of the right column and really focus on those therapies that are proven and that might help you in a first phase. And then it's always possible to see, okay, which more experimental therapy might help a bit more. So I've come to the end of my presentation. I really hope I have provided you with some more insights, and this will guide you some bit more in the future. If there are any questions, I'm open to answer any questions, or please feel free to contact me afterwards. Thank you.
Perfect. Thank you, Annick. I really appreciate you joining us today. That's it. If we can, that's perfect. So if anyone does have any questions, please feel free to put those through to the chat. I've had some questions already so far. Some people really saying thank you for such interesting information. So thank you so much, Annick. First question is, will your book be translated to English, do you think?
Good question. I have been hoping it will, and I have to be honest. I was looking for a publisher, but it's quite difficult and apparently quite a high cost. So at this moment there are no plans. But if there is any interest of a publisher listening, I am very interested. I have trying to publish it, but unfortunately it hasn't worked yet.
Okay. Um, so another question then. Do you have any current research that you are doing at the moment and any research of your students that we should be looking out for?
We are doing a lot of research. We have maybe just a few. I can say is we have a trial running on somatic tinnitus, so on the neck and the jaw complaints, and this PhD she will defend in September. So this research is actually finished, where we saw that very specific physiotherapy for those people who do have somatic tinnitus or are diagnosed with that really helps and really alters the volume and really can lower the volume. I'm not saying the volume goes to zero, that would be a bit too much of an extreme, but it can really help and alter the volume to a certain extent. So it is really helpful to do physiotherapy. So we have that one. We have a more fundamental and imaging study as well. As I said, we have done a lot of neuromodulation studies in the past, so where we try to, from the outside, with some electrodes, with electricity, try to change the inner activity of the brain and the activity that is connected with the tinnitus. We haven't always been so successful on that because one patient is better with neuromodulation, the other is absolutely not. So there was a lot of variation. We mainly saw that most of them were not better. So we did a few years ago, like the first very large, what we call placebo-controlled study. So where part of the patients got the real stimulation and part of the patients got the placebo. They, of course, themselves did not know what they were getting. And we saw that there was a decrease in tinnitus in general, but unfortunately, there was no difference between the active group and the placebo group. So what we actually were measuring was a quite big placebo effect because of the hope they would get better, because it's a very intensive treatment. You come to the hospital 8 times in 4 weeks time, so it's very intensive. But we see that like the actual therapy was not really working. So that's not what that we say that neuromodulation doesn't work, because there are now a lot of neuromodulation protocols, but we have to be critical on that, and some reflective that there might be a large placebo effect, and that also the current, electrical current going into our brain might be different for you than for me. So there will probably just not be one stimulation protocol that will work for everyone. So our next project will actually be more fundamental, and with imaging there we will see like what is your skull depth, and how does the stimulation glide through your brain, and how can we alter the stimulation protocol for what really works for you. So like really individualized stimulation protocols. And this will be something that we will start in September.
That's really interesting. And it's something we talk about sort of quite often about this placebo effect and different treatments for tinnitus. And I suppose for tinnitus patients themselves, as long as there is a benefit in their tinnitus and they are noticing their tinnitus less, then I mean for us as clinicians, we want to know the evidence, and we want to know if these things really work. We want to realize why, and have all the answers to the questions. But to patients, do we necessarily need to know whether it has worked or not? As long as the tinnitus is better or perceived in a different way, then I suppose
Mhm.
it's been successful for them.
Yes, I completely agree with you, and it is true that placebo effect is not necessarily a bad thing, not at all. You can call it your free ride as a clinician. Whatever helps the patient helps, and that's a good thing. What my struggle with that is if patients are paying a few thousand euros or dollars for a certain device that is actually might providing just placebo effect. I
Yeah.
think we then can think of devices or stuff that are much cheaper, that might also help. And also those kind of effects and placebo effects, they are not lasting forever. So I think there it will change the effect between what is a real effect and what is actually an acute placebo effect, because we do see the patient a lot, because they have intensive treatment, because they have the high hopes, which you should have, but the high hopes that something works. But this effect will not last a year later, when you're not coming to the clinic 4 times anymore, when you're not paying 3,000 euros for a device or something, this effect will run out. So on the long term, I have problems with that. And this is why we still, as a clinician, really have to pay attention that if we are providing a therapy, that we do have the scientific proof that it works and it is effective, and not just the placebo effect, which
Yeah.
in a first time point, yes, might be very beneficial, but it will not last.
That's really interesting. And in regards to that point, is that something that will be considered in the research that you're doing, that actually trying to find the evidence that the neuromodulation works, whether it has a lasting effect as well?
Yes, because in the new protocol that we want to do is that we will provide stimulation on tinnitus patients and also see before and after how the brain reacts with EEG, to see how the brain activity responds and how also the people respond, whether they are better or not. But indeed, as you say, might be a placebo effect. But we will also do the same with patients or people that do not have tinnitus, so normal hearing, non-tinnitus patients or patients that are matched according to hearing. So the only difference is actually whether they have tinnitus or not. To also provide the stimulation and then see, okay, what does change in their brain also, and what overlaps between the two groups, and what might be different in the group with tinnitus or not. And also there we can again introduce the placebo effect, so also see what happens during placebo effect as well. So it would be three groups that you can compare. So we are kind of hoping to see uh, the differences there.
Yeah, that's amazing. Well, thank you so much, Annick, for joining us today. We really appreciate it. If anyone has any questions for you, obviously you've posted where they can reach you on sort of social medias and your emails. So that's excellent. Thank you so much. And obviously the same for Hishir International. You can contact us via email or for our various social media websites as well. So thank you so much for joining us, everyone. And we'll see you next month. Thank you.
Bye bye.